So we know from previous studies that the pons is a key brain area involved in migraine pathophysiology. In particular, the dorsal region of the pons has been suggested might represent the so-called migraine generator. Against this background, the aim of our study was to elucidate the role of the pons in migraine pathophysiology using a longitudinal study design and exploring the association between functional alterations and the patient's clinical characteristics. So we enrolled 91 episodic 83 patients and 73 controls. We obtained for patients and controls resting state function MRI and high-resolution T1 weighted sequences. And for patients, we also collected clinical data. So among patients and controls, around 23 patients and controls agreed to be re-examined after a median follow-up of 4.5 years. So we observed that during the follow-up, around 35% of patients reported an increased number of migraine attacks, while the remaining patients were stable or reported a decreased number of migraine attacks. Regarding the imaging findings, we found that at baseline, compared to controls, migraine patients showed a decreased functional connectivity between the pons and the cerebellum, the temporal and lingual gyros. So over the follow-up, we observed that compared to controls, migraine patients experienced a decreased resting state functional connectivity between the pons and the precuneus, an area that is known to be involved in sensory integration, as well as we observed that compared to controls, migraine patients experienced both decreased and increased functional connectivity between the pons and the cerebellum, suggesting that distinct adaptive responses might occur at the level of the cerebellum. And in particular, we observed that the increased functional connectivity we found between the pons and the cerebellar area crus 1 was associated with an increased number of migraine attacks over the years, thus suggesting that these functional modifications might represent a maladaptive response, thus influencing the disease course.